Welcome, everybody, to another episode of Need Some Introduction. On today's episode, we'll be breaking down the first episode of the second season of the HBO Max series, The Pitt, returning after its victory lap here for winning almost all the many Emmy Awards this year. Also, my number one series for the year. A little surprising to me, to be honest. Joining me for this conversation again is my wife, local medical expert for Need Some Introduction podcast, Kimberly.
Thank you, Victor. Thanks for the introduction.
Before we get going, I just published recently my favorite shows of the year and my favorite movies of the year. And now I'm just going to put you on the spot because I did not prep you for this at all. But did you have a particular show or movie or even a performance, anything that you wanted to shout out that you really appreciated this year? We did just recently see One Battle After Another.
I thought that was really good. Thank you for forcing me to sit down and watch it. I thought it was super entertaining, and I love the cast, and I would highly recommend it.
Yeah, that's just available on HBO Max. Again, anybody who listened to I was actually surprised by this. I did not do it intentionally, but my best of list for movies was basically, this is available on HBO Max, and this is available on HBO Max. And if I had legs, I'll kick you my favorite female performance of the year, Rose Byrne, and that will be available on HBO Max in 2 weeks. So it's like, I was actually very surprised that everything's on HBO Max pretty much. So good for you, Warner Brothers, although you're probably going to be acquired by Netflix and they're probably going to ruin it. Oh, by the way, Kim, you just got a letter in the mail, right? Paramount's hostile takeover, trying to take over that Netflix bid on Warner Brothers. So you are part of the decision-making here for this purchase. Yes,
apparently I own some of their stock directly. So I guess I am a decision maker. But I did throw it in the garbage.
The one or two shares that you own.
It's a very big pull I have with the company, obviously.
And lastly, before we get into the conversation, just a reminder, the next episode will be publishing also on HBO. Again, just this is becoming an HBO podcast. It used to be like an Apple TV Plus podcast. Now it's a HBO podcast. Darren and I will be discussing the season premiere of season 4 of Industry on Monday. That episode should be published, hopefully, if I'm able to get it out in time. And so stay tuned for all of that. And continuing to cover The Pitt, Sona and I will be discussing Hijack next week, along with The Night Manager, a series that she's been looking forward to, a sequel of this season for years. As a matter of fact, season 1 was 10 years ago. So a 10-year sequel, finally. And 3 episodes will be dropping this week. Okay, so this episode, very exciting title here. It's called 7 a.m.
We are starting the ER shift over again. So now we have a whole season that will take place in one day. It turns out that 10 months have transpired since the end of the first season. We learned that a little bit later on in the show. So now we get to see them 10 months later after they've recovered from the previous disaster.
Yeah, so it turns out, I mean, I guess apropos of nothing, this is July 4th weekend, we discover over the course of this episode. We also find out that it's been 10 months since Langdon has been there. So I guess that was September. Was there any signifier in the previous season indicating that was it like Labor Day weekend or anything? It wasn't anything like that, was it?
No, I mean, the weather was nice. They sat outside after their last shift and drank a beer in the park. So it wasn't wintertime. So probably September.
So when the episode begins, we see, I didn't even think about this as a motif for the show, but of course, the only time, and this makes perfect sense, we saw any exterior last season was in the opening sequence when Ravi was arriving at or Robbie, I guess they call him, was arriving at the hospital. And we see the same thing here. This doctor does not wear a helmet when he rides his motorcycle.
I know. He's participating in very dangerous behavior. He's going to be one of the next trauma patients riding that bike around Pittsburgh.
He does bring the helmet with him. It's on his backpack. So does he bring it in case he has a passenger, I assume, someone riding with him?
I know. Do as I say, not as I do. What the heck is wrong with him?
Yeah, I mean, literally in this episode, someone criticizes someone for not wearing a helmet, riding their bicycle in their own neighborhood, and Ravi's riding a motorcycle on a highway and passing the car in front of him, by the way, into oncoming traffic without a helmet on.
It was nice to see that opening scene of Pittsburgh. It looks so beautiful from above with all the bridges and skyline.
Only from above. I'm just kidding. If you're from Pittsburgh, you're just joking.
Did you know my mother lived in Pittsburgh?
I did. Your mom talks about it all the time. And she still talks like Pittsburgh is exactly as it was 60 years ago. But it's not actually. It's a big tech center now. It's really come up recently, although I'm sure it still has its problems because it was a very, economically depressed area for a very long time.
So you want to talk about the beginning of the show? One of the first patients that comes in was a dishwasher who got stabbed in the chest. And he comes in coding with CPR in progress. And apparently he just had lost his pulse. So they think that he is viable. So they bring him into the trauma room. And of course, everyone who is casted on that show is involved.
Yeah, the entire cast of all the new and returning characters. Actually, let's start there. We find out very early on that Robbie is taking a sabbatical. He's taking at least 3 months off. He's going to some kind of Native American or a Native North American, I guess, because Canadian territory. But most importantly, he has a replacement attending. Of course, very different style here. Now, he seems to be on board with this. My first question to you, obviously, I do not know any idea how these hospitals work, and this is a fictionalized hospital to boot. But if this type of thing was to happen, would there be any, would the existing attending, the current attending, have any say in his replacement at all?
Well, it seems like these are the only 2 attendings that work in the ER, as if you have to hand the baton over, when in fact an ER like that would have multiple attending physicians and there wouldn't be any handoff that would need to necessarily happen. It's just, you're a new doctor here, you start your shift, you do your ER doctoring, that's it. They make it sound like, she's now taking over the place. And obviously it doesn't go over all that well with Robbie. He's trying to keep his cool when she's instituting new policies and she hasn't even done 1 shift in the ER. So that doesn't really go over so well, but he's trying to keep it together. Yeah,
it's interesting actually that he starts off with this, basically saying he's totally on board with this and she's going to be shadowing him and do as she says. But immediately that starts to ruffle his feathers when it seems he doesn't know much about her. He's like, oh, is the VA a trauma center? Which is an interesting point. That was one of the things I wrote right away is, would you pick a VA attending as a replacement for a trauma center? I guess maybe this is what will be explored over the course of the season, but she doesn't have this practical trauma experience and she probably gets really, really good customer satisfaction scores, which is part of the reason she appealed and maybe wants to move up in her career or something. But I thought this is a really weird fit for this hospital.
Yeah. I mean, in reality, you have trauma surgeons that cover the traumas that come into a trauma center. The ER doctors are not even involved in the traumas, but this is a fictionalized hospital. So yes, you would expect someone who's taking over as the, lead ER trauma doctor to have trauma experience. But she does institute, the ER passport where patients can fill out a pamphlet about themselves when they get into the hospital. And he's like, oh God.
Well, that was my second question. Is that something or something not exactly like this, but is there something like this that is some kind of policy they try to impose in hospitals?
Not that I know about, but I haven't been a full-time ER provider in a number of years. So.
Oh, and the last question I had for you, just in this opening section, is: have you ever had to do one of these tests with one of these dummies in this kind of situation? Other than medical school, did you ever have to do this, or even in medical school?
The only time we work on dummies is when we're doing our ACLS recertification, where you learn how to resuscitate a patient who's in cardiac arrest, essentially. So we have practiced on dummies, but not in the middle of an ER shift.
Just your patients that are dummies.
Unfortunately, yes, a lot of them are.
But so seeing this, did it make you laugh, just this setup where these people are the patient is dead and it's an actual dummy? To me, as a layperson, this seems pretty cool that you can program a condition into the patient and then test out the knowledge of your doctors.
Yeah, that's how you do it when you are doing a real ACLS certification. You have a mock code and they put rhythms on the monitor and you have to learn how to treat the rhythm and call out what drugs you're giving and when you're doing CPR and when you're shocking. So that does happen.
A couple more things that they introduce here early in the episode that I was curious about. We see that Javati has become more and more alienated from her surgeon, mom. It happens to be passing by just to check on the patient, but also, of course, to check in on her daughter, who seems to be completely ignoring. And this is an interesting dynamic. I've known of people who are multi-generational doctors and the way that, like, so it's definitely exploring this expectations that your parents have of you. But what do you think of her mom wanting her to get into surgery? I do assume that a surgeon's lifestyle is better than being in the ER. And what kind of career path is there in being in an ER? Unless, as we saw in season 1, that, it's good for people who have ADHD.
I wouldn't say a surgeon's lifestyle is better than an ER lifestyle, because when you work in the ER, you work shift work. So when you're done with your 12-hour shift, you turn over to whoever's coming in for you and you walk away. You're not getting phone calls. You're not getting called in on emergencies in the middle of the night, as opposed to a surgeon who does not work shift work. So it's much more of a difficult lifestyle to be a surgeon than an ER physician for that reason.
Well, that's interesting because you used to work in trauma and then you went to work for a surgical center because you thought you would have a better lifestyle. So maybe it's different now?
Well, the advantage of being a PA is that I am not the surgeon doing the operation. So I can diagnose what's wrong with them and get them into the operating room and turn them over to the surgeons who are then having to stay and do the operation for many hours. Obviously,
you're a PA, not a surgeon, but from observing surgeons, I would also assume that maybe there are different stresses in being a surgeon, but also you can take time off because you can, schedule surgeries at different times. But the salary, I presume, once again, I don't actually know what this is, but the salaries, I assume, are much better for surgeons than they are for ER doctors.
Yes, I would presume so. I don't know exactly how much money everyone makes, but yes. Surgeons have much higher income potential. It also depends on what type of surgeon you become. If you're a plastic surgeon and you only do cosmetic surgery, then you have a pretty nice lifestyle. My comment before is coming from the perspective of vascular surgery, which is what I do now. And my surgeons don't have the greatest lifestyle, considering a lot of what we do is emergencies, but there's plenty of surgeons that don't do emergencies.
A couple more questions I had, really just about the show itself. What did you think? We personally, me and you, have had conversations about the frail egos of surgeons and people in the medical profession oftentimes, not always. What did you think about seeing Landon coming back kind of with his tail between his legs? Very different. I mean, immediately, this actor doing a really good job, I think, showing up and having a very different demeanor. Of course, being brought low and being like the star and often to a large extent of the ER in the first season. And then, of course, embarrassed by the discovery of his drug use and the tension he still has with Robbie's relationship with him.
I think the character was very subdued because obviously, as you said, he's embarrassed because he had to step away for 10 months to get treatment in rehab for his benzo addiction. What I found entertaining was they had him sit in the waiting room before they would let him into the ER. Like he's just amongst all of the patients waiting to be seen until they can activate his ID and get him back in there. They're definitely taking him down a notch by making him sit in the waiting room. And then, of course, Robbie assigns him to go to triage. And he's like, really? Which is, that's not where the action is. That's where you make a quick eval and send them to whatever part of the ER they need to go in. So not glamorous in the least.
Yeah, Langdon, I assume, wants to hit the ground running. And, he even says so. He's like, I already picked up a patient. And this is like, nope, that's not what you're doing. And of course, Mel is like, oh, I'll do it. I'll do triage. I like doing triage. And he's like, nope, I'm trying to make a point here. Speaking of Mel, she's dealing with some tension because she is being called for a malpractice suit. And I like how she is so stressed out about this. Very funny performance here and how awkward she is. I mean, in general, she's awkward. She has a sister who is autistic, but in every possible way, it seems like Mel is probably on the spectrum herself, although obviously much more highly functional. But what did you think about this? Everyone just kind of shrugging their shoulders, being like, you work in the ER, everybody's got some kind of lawsuit against them.
Yeah, I do feel her pain because she is stressed out about this deposition that's coming up and she's trying to work her ER shift. I had to be deposed when I was an ER provider. I wasn't personally getting sued, but the patient I had treated was suing her landlord. And I happened to have seen her multiple times in the ER for this ankle injury that she came in with. So I had to be deposed and just testify to what was in my notes. So my career was not on the line, but I lost many nights sleep over it because I had never been in a deposition. It was a little scary, but after it was over, it was no big deal.
I was going to say we're probably going to see the deposition the next week because we can talk about the trailer for the season. But yeah, that's not a trailer for the next episode, which I assume will be the format going forward. HBO, unlike a lot of other, like Apple never shows a trailer, but HBO does have a trailer at the end of its episodes. But this was a season trailer, so we do see her seeming very nervous and going in for the deposition. Maybe that's next episode. But then again, this is, by the way, a 15-episode season again. So we already know that something is going to go bad in yet again another, hopefully not similar to last season, but there could be some kind of fireworks situation. It would make perfect sense. That could lead to some kind of influx of patients to the hospital, given the fact, it's going to be another 15-hour shift, which is not a normal shift.
Back to Mel real quick. I did find a number of scenes that she was in to be funny. It's like a little bit of comic relief when you're in the ER. She is getting hit on by one of the patients. She's like suturing up his leg. And he's like, "Oh, do you drink coffee?" She's like, "Nope." "Do you do this?" "Nope." And then he asks her "Do you drink boba?" And she perks up and looks at him and smiles. She's like, "I love boba." That's funny.
Yeah, that's one of the cliffhangers of the week is like, he'd be like, "Well, would you want to get boba with me?" Which I assume will be the follow-up question. But that's one of the cliffhangers. We have quite a few cliffhangers this week, actually, to keep us on the hook. Okay. Oh, of course, I forgot to mention Langdon shows up and Dana is back, also the charge nurse who won an Emmy last year for Best Supporting Actress, deservedly so, I think. And you mentioned yesterday that like the charge nurse is in a large way, like she runs the floor, right? And I think that very much is explicitly in the first season of the show as well. But a quick question I have for you. This just came to mind, but so Dana's coming back after being punched in the face. It's one of the most brutal things that happened in season one. You really feel bad for this person who's, so strung out. And obviously the patients are frustrated, but you should never punch somebody in the face. And two things that I thought were interesting here. One is a question for you is, have you seen this type of violence before in any kind of medical situation? But also, is that standardized when she is training this new, very young, very green charge nurse trainee, this nurse who shows up, who's adorable, by the way. I can't wait to see her. Like, she's really been thrown into the deep end here. But the situation where she's warning her, like, these are the signs that someone might be getting violent like that. And what's the code word? Hula hoop? If you feel like, just say that word and everybody knows what it means, that there's some imminent threat. Have you seen someone kind of dealing with the trauma of some kind of physical altercation with a patient? And is that true that there's this kind of protocol?
Unfortunately, medical providers and nurses do get involved in like physical altercations on occasion. Like nurses have gotten peed on and punched and their hair pulled, but nothing blatant like we saw in that first season where a patient who's now deciding to leave the ER because he doesn't want to wait sees her standing outside and just walks up to her and punches her in the face. That's a pretty blatant
because she's taking a cigarette break, by the way, and she's trying to quit smoking in this, so maybe there's a connection there.
I don't think so. Yeah, so that was, egregious violence, which I've not seen, thank God.
But is there this protocol, like the code letters, that there's like, how do you, pacing and those other signs?
I mean, maybe that's an acronym that they use now in the ER to identify like potential threatening behavior. I just haven't heard it.
By the way, I have a tendency to raise my voice when I get excited about things. Even here on the podcast, you probably noticed, not necessarily because I'm angry, but just because I'm getting excited about something. And I have a tendency to pace. So I was like, they were going down the checklist. I'm like, if I was in the waiting room, I'd probably be called out as a potential violent offender.
Yeah, you're suspicious with all that pacing.
The only time I don't pace is when I'm doing this recording. Oh, and of course, the thing that they're drawn into, I do want to get, this is all preamble, by the way, because I do want you to break down some of these actual cases. That's why you're here. But one more piece of information, that one more question I had as I was watching is of course, when the charge nurse and this new nurse trainee show up, they, the first task they have is to take care of this incredibly funky smelling homeless person. My question to you, when you worked in trauma, obviously, is not in this particular case, because you're not waiting for people to come in, or maybe you are, but I have to assume that just in trauma, someone's like on a work site, probably sweaty and stinky from being in 95-degree weather as a construction worker, and all of a sudden something fell on their arm, or something tragic or catastrophic happened, and they show up in trauma. How do you guys deal with some really, really stinky bodies showing up?
I can't recall having an experience like they described on the show, where this homeless man is so disheveled and so caked with
He's
dirt.
Caked, yeah.
His ears are dirty. Every part of his body is just gross. And they put him in the shower and give him a bar of soap, and he cleans himself up. I mean, I deal with gangrenous, smelly limbs in vascular surgery. You just kind of put a mask on and move on with your day. I do have one story about a woman who came in who had not had any sort of hygiene to her legs or her feet. She hadn't cut her toenails in 7 years, and her legs were just caked with dead skin and cat hair. And it smelled so putrid that's the vision I had when I was seeing them responding to the smelly homeless man. I was thinking of that cat lady.
Oh, it's always the cat lady. All right, so let's get into some of these cases. So the first one, of course, we have the big one you already started introducing, the stab wound to the chest, and this procedure where, what do they call that?
It's a thoracotomy. They opened his chest.
What's it's bleeding from, what do they call that?
You have to presume you're bleeding from the heart or the lungs if you get stabbed in the chest. So they did a left-sided thoracotomy to expose the aorta so they could potentially cross-clamp it if they needed to, if the injury was below it, or to get access to the heart, because that's how you get in from the left side. I think you're talking about the hilum.
The hilum, yes,
I know.
The hilum.
Robbie, they're trying to figure out what's bleeding, and they can't really figure it out, and he tells them to flip the hilum.
No, they twist the lung, right?
Yeah, that's what that means.
Oh, so the hilum is attached to the lung?
It's a part of the lung.
Interesting. And that works. I do like the fact that the other attending, she's like, oh, you could kill him if you tear the lung off. And I'm like, I think given how much blood this person's losing, I think if they don't do something quick, they're going to die anyway. So, by the way, we watched this with my mother, and she's had open heart surgery, and she was very uncomfortable watching this scene. And I was kind of shocked the amount of, I wasn't so shocked that they would open one side, but when they cut across the sternum, I'm like, you could open someone's chest that much and put them back together again? That's crazy. Like, doesn't that break your spine or something? I'm talking very ignorantly here, but.
Well, when you get open heart surgery, like a bypass like your mom had, they open up the sternum. They use a sternal saw. They get into the chest cavity in order to get access to your heart. When they did the thoracotomy, they started on the left, and then they converted it to a clamshell thoracotomy, which means they open up both sides of the chest. So there's stuff you got to get through to get in there.
It's terrifying. I mean, really like a horror movie, but very realistic, though, right? Like this is, once again, as a layperson, this looks like an actual
it does.
lung and heart.
It looks like a live beating heart in the chest. They do internal defibrillation and get the patient back.
This is one of the things I really appreciate about the show, and this is me speaking ignorantly because I barely watched ER back in the day, and obviously so naive of me. Unlike you, I think you've probably seen a lot more of these medical dramas. And I did love House, like I mentioned in the previous episode, but House wasn't really about the surgery, having so many different presentations of the anatomy of the patients, although they would have some. This obviously feels much more realistic. I just find it so fascinating to, again, as a layperson, that the show is able to explain it to me just visually what's happening. Immediately when I see the heart and it's having AFib and then they VFib, I'm sorry. Yeah. And then they shock it, and then it is in normal rhythm again. Even before they say anything, I'm following it visually. I think it's really impressive.
Great,
yeah.
As a non-medical person, to have it make sense, which I would assume it makes sense to people who are watching the show, because a lot of medical providers are not watching this show because they need a break.
I'm sure they eventually have binged it all, I presume, but maybe not. But yes, many people watched this show. Side note there, when it was running, I think by the finale, about 10 million people had watched the show by the end of its first season. But since then, of course, it's been on a lot of top 10 lists. When it won the Emmy Award, it jumped back into the top 10 streamers for the subsequent weeks, almost for a full month afterwards. They just ran it last month throughout the holiday season on TBS for people who don't have HBO. So I can only imagine how many tens of millions of people have probably seen this. And I'm very curious to see last year it started off with around 3 or 4 million people. And by the end, it was getting to 5 to 10 million people by the end of the season. I have to presume that this ratings for this premiere episode are going to be much, much higher. So I'll make sure to update everybody once we have those numbers in a couple of weeks. The next case I wanted to ask you about, it's actually, let's circle back to Langdon. So Langdon is talking to this guy who has what's this guy's name again? I forget his name.
He's got cirrhosis and liver failure.
Yeah, I was going to ask you about that. So they have to drain the fluid. I guess we'll see this procedure next episode, but what does that entail?
Yeah, when you have liver failure, you can fill up with what's called ascites. It's like fluid in the abdomen. Because your liver's not working, your protein levels are affected and you get a fluid buildup. So basically you use ultrasound and you put a needle to drain the fluid in the peritoneum. But usually they don't have the ER doctors do that. They usually go to the ultrasound department for that.
Well, I'm sure here they do everything. And this is a one-stop shop for all procedures, apparently, in this ER.
It is. So yeah, that guy's not doing very well. He's a chronic drinker and he hasn't stopped drinking. So he's got a limited life expectancy.
There's probably a bunch of other little cases, and feel free to add any color here of anything I might have missed. But I had there's three cliffhangers basically in this episode that are going to pull us through to the next episode. Mystery number one. By the way, you spotted this and I did not. You were so distracted when we were watching this last night about the little girl who comes in with the chin.
Yeah, she comes in with a chin laceration and she's had recurrent ER visits for various fractures and things. So they are suspecting that she's been abused. And I was distracted not by the medical part. I was distracted by the fact that I knew who that actress was because she was in something that we had seen. And she was so familiar. And then we figured out that she was in The Bear. She was the daughter of Cousin.
Cousin, yeah. So she's been in The Bear just recently, of course, very memorable in that episode, Bears, when they're all under the table together, if you've seen that season. Okay, but in this case, so I have to assume that even though she presents in every possible way that she's been abused, my guess, maybe I'm wrong about this, by the way, maybe it is abuse, given the fact that she seems so clueless in answering these questions, like, no, she seems very casual. It's not like he's trying to hide anything. So for me, reading it is that it's going to be something that in every possible way is going to read as abuse, but it is something else. Did you theorize some alternate explanation when you were watching last night?
I mean, it looks very much like abuse. She has flank bruising and she says she didn't injure the flank. She has a chin laceration. She's covered in bruises. So they're setting it up to be abuse, but I suspect it's probably some hematologic disorder that she has that's causing her to bleed and get bruises.
Yeah, I had a friend of mine when she was in college. She had some blood disorder. I honestly can't remember off the top of my head now. And she passed out and the subway doors closed on her leg. She had severe bruising on her legs afterwards, but of course it was just like a mild pressure from the doors, not severe enough. Turned out to discover that she had a bleeding disorder.
Yeah, I have a feeling that's where it's heading. At least I hope so, because I don't want her to have been an abused child.
Yeah, it could turn out to just be a blood disorder and all this thing blows over in a couple of weeks. This early in the season, I'm sure they're going to have things that are going to pay off later on in the season, and some things that will resolve in an episode or two. They keep these little dangling threads to keep us intrigued.
And what is the second mystery, Victor?
Oh, we'll leave the last one, the very final moment cliffhangers for your last speculation. But the second one I have, of course, is this guy with this weird phantom pain. He seems to be disoriented. He gets violent when McKay tries to check his pain in his leg that he's now mentioning. He seems disoriented, but then he seems to be with it all of a sudden. He seems to be hiding something. What is your read on this? If you were presented this patient, what's your differential, doctor?
Well, he comes in with like minor trauma. He had a nosebleed and a wrist injury, but he claimed to have not hit his head. So my gut is telling me he has a brain tumor because he is not acting normally. He forgets he's in the ER. All of a sudden his limb jerks forward and he can't remember why he's there and he's confused. So I bet they're leading us down the road of brain cancer.
Brain cancer. You seemed excited about that. And the pain moving around, would that be an indicator of this as well?
Well, no, I mean, he has pain in his arm and hand, so I don't think he has migratory pain. It was just pain from injuring his wrist. Right?
Well, then at the end, all of a sudden he says, my knee hurts. And she goes, did you bang your knee? And then he has a reflex.
Yeah, I don't know. This one doesn't give me an obvious differential.
The brain tumor, though, could make some sense there.
Like spastic reflexes and whispering.
Just whisper. This what makes this an ASMR podcast. Okay, so of course the last mystery I had, or actually before we get to my final mystery, because it's the button on the episode, any other notes you had from yesterday?
Oh, one thing I wanted to compliment them on was their use of hand sanitizer. Because you are supposed to sanitize your hands before and after seeing a patient, and they appear to do that on the show. It's like amazing.
I can't believe it.
The one other thing that was bothering me slightly was when the patient with the stab wound to the chest came in and they decided to open his chest. They only put like a drop of betadine on his chest, which is the liquid we use to sanitize the skin before you make an incision. And no one was wearing sterile gowns and their hair was exposed. And I didn't see any sterile drapes besides a few sterile blue towels, which is good. We use those in real life. That procedure was very unsterile.
Oh, one more thing before we get to the final that I just remembered. I don't think this is going to have paid dividends later in the show. I just thought it was a funny observation. Was this person coming in with his wife as well? And she's very adamant that someone, take his attention to him right away. And she's like, here are the 400 supplements he's taking right now, the bags full of supplements.
Yeah, I love that because when you have a patient that hands you 3 bags of medication, you just want to roll your eyes like, oh my God, good God, what is this? He's on all these supplements and naturopathic remedies of God knows what variety. And now you have to sort through it all and figure out which one is causing his side effects.
I have a question about that, though. Like, if they're under observation because you can't diagnose it and they're still in some kind of critical, like something's still off, do you just wean them off of all this stuff to try to get to some baseline before you start reintroducing things? Or how do you address that?
I mean, in reality, if you check their blood work and their vitals are normal and there's nothing abnormal in their labs, you would just tell them that they need to follow up with their primary care provider to discuss these supplements. The ER doctors don't have time to get into a list of drugs a mile long unless it's like an immediate life-threatening risk. But this guy obviously isn't dying, so.
Yeah, so the only last thing I had was, of course, in the final moments of the episode, there's, first of all, of course, this baby's been left behind in the bathroom. I presume they actually have cameras there, so I presume they would see something suspicious. Even if someone smuggled the baby into the bathroom, they would need to have something to smuggle it in, so there would be something suspicious about arriving. And so I'm sure they'll be reviewing the security cameras. But my assumption here, just given the way they present this, it is the deaf mother that is that what you're reading as well?
Oh, I didn't think of that until you just said it, because you see that the deaf woman in the waiting room and they call her name and she doesn't hear them. And that's all you really get out of that scene. So I did not think that the baby and the deaf woman were related in any way.
The reason I made that connection is because you see her reacting. There's a woman like moving her arms, and then you see everybody running into the bathroom. I assume this woman found the baby in the bathroom, and we see it from the perspective of the deaf woman. So I'm thinking, is she there to make sure someone gets the baby? Or so anyway, and then of course they're announcing on the last scene. That's the other time we see her, and she's just like looking straight ahead. And they're announcing, did someone leave their baby in the bathroom? And we're seeing her as they're announcing this on the loudspeaker. But I don't know. I still have to assume that she was doing it on purpose. It's not like, oh, yeah, my baby.
Yeah. Good for you for making that connection, because I did not put those two things together. And when they're looking at the baby and he or she appears healthy. She. The only thing that's wrong is that the baby has a fever. And then they do what's called a point of care CBC, which is just like a blood test from like a couple drops of blood to get a quick result. And the one doctor looks at it and is not fazed. And then she hands the blood work to the new attending, Dr. Al, who then has this blank stare and she looks concerned. And then the episode ends. And the other doctor was like, oh, did I miss him?
Right.
So I had to rewatch that because I missed some of the details. Because I was thinking like, oh, now the baby has leukemia or something's abnormal on the CBC. But the first physician reviewed it and it was normal. So something about this baby triggered a memory in the new attending. So we were left at a cliffhanger on that one.
I could be completely wrong about this based on, because first time I watched the episode, I forgot to watch the trailer. And then when I watched it with you, just by chance, by the way, because you're trying to rewind to that scene and the trailer ended up playing. And then I'm like, oh, yeah, I should have watched that. What I was concerned about when I saw that is she seeing an indication that the kid could have something, maybe the baby's come from overseas or something, that the baby has something that might be infectious. Would there be something like in a blood test that you could see something that might indicate something, a red flag?
Well, it was a CBC, which shows the white blood cell count, red blood cell count, hemoglobin, hematocrit, and platelet count. So it's just basic hematologic labs. So the white count could be elevated, but that wouldn't make her zone out and become catatonic.
Yeah. So anyway, I can't read that either, but I was thinking that maybe she saw that there's going to be something catastrophic, like potentially this baby had some, like the plague or something, and that they had to quarantine.
That would not result on a point of care CBC.
Yeah, but CBC would not indicate that apparently. So anyway, that was weird. I was just thinking plot, not thinking about medicine. So. But yeah, very curious. I honestly cannot understand why she would react that way. And the other doctors also seem to be surprised. They're like, what did I miss? Like, why is she reacting this way? So as far as the episode goes, I thought, this is a slow start. Most reactions to this from boards and such that I check were mostly positive about this episode. I thought it was very solid. I mean, we just binge watched the second half of the season, so it hasn't been a long time away from this show. Kim just actually caught up on this show just over the holidays, so it's very recent. So I thought they progressed things well, and as they did the first time around. Like, this show does not hit the ground running, sets things up slowly to it's going to build to wherever it's headed. Still don't know what that is going to be as things escalate over the course of this shift. But I liked some of the new characters as well. I do like this very odd coupling of this very tall, socially awkward guy and this very sarcastic, short Asian girl as well, who are the student doctors this year. And of course, we're catching up with our favorite characters as well. Any favorite little character moments in this episode?
Well, I mentioned the boba comment. I liked that. I also like Huckleberry because he's grown up a little bit since the first season. I'm presuming now he is a resident because he was a medical student 10 months ago. So medical students only stay for 6 weeks in the ER. He's back and he's kind of got his wits about him, and he seems to be competent. So he's grown as a character. And I think the show was a little slow, so we haven't seen too much character development in the other characters from last season, but there's more drama to come, I would presume.
Have you ever been in a situation where you're in surgery, for example, and you had what happened to Samira, where her phone keeps dinging? It turns out some drama with her mom. Is that something that you've seen before?
We usually do leave our cell phones on ring when we are in the operating room because if someone is desperately looking for us, we want the circulating nurse to answer the phone. So every now and then I've asked the nurse to answer my phone, and it's like a telemarketer or something. Most of the time it's just endless text messages, so I can hear text messages beeping while I'm trying to focus on the patient at hand on the OR table.
That seems like a better idea, though, to leave the phone with someone else and, only get called in if it's an emergency.
Yeah, sometimes when I go in the OR, if I'm not scrubbed, I will, take the phone out of the doctor's rear pocket when it's ringing and answer it for them. The worst part was the surgeon I do work with, who used to have Google glasses, and he would operate with the Google glasses on. So he'd get text message alerts that would come to the glasses, and he could make phone calls just by speaking into the speaker. So he could call me while he was doing an operation to tell me some random bit of information that could wait a few hours. So disruptive.
I was just talking to you about, or someone recently, about the things that I think have failed technological trends that are supposed to happen. And the wearables is definitely one of these. And Meta has made such a huge investment in this. But I have to say that I don't want to be having lunch with someone while they're answering text messages via their augmented glasses. I definitely don't want my surgeon watching Netflix. I'm just kidding. While they're doing surgery. Not doing that. But yeah, obviously I'm kidding about that part. But I definitely do not want text messages being read while they have their hands inside my chest cavity.
I would agree with that. We have way too many distractions in the world.
Oh boy, I wouldn't even want a TV on with the golf game on, much less having actual glasses on your face. I know who you are, by the way. Don't do that.
He's listening to this podcast.
All right. So, very much looking forward to the next hour of the show. I could predict the title of next week's episode, 8 a.m. And we will regroup then. Thank you again, Kim, for joining.
You're welcome, Victor. I'll see you again soon.
We'll see each other very, very shortly.
Bye.
Bye. Thanks, everybody.